OAC and a broad coalition of medical health professionals, unions, child advocates, and environmental groups support this bill. BPA has been around for a long time. So why are we just hearing about these problems in recent years? Well, science, like many things in our modern society, has significantly advanced in the past 60 years. And while the original intent of BPA use for polycarbonate plastic was not meant to cause harm, our current science tells us that we should be concerned. It doesn't stay in the products in which it's used. It leaches into our food and drinks, including into the contents of our children's baby bottles. It gets into our bodies. We know that more than 90% of Americans have detectable levels of bisphenol A in their bodies. Young children and lower income people have the highest levels of BPA in their bodies. BPA is a hormone mimic. This means that it can act like and interfere with normal functioning of hormones in our bodies. That's stuff you don't want to mess with. Hormones are finely tuned, and we don't want to mess with that. BPA exposure has been linked with lots of things: behavioral changes, breast and prostate cancer, reproductive problems, including infertility, low sperm count, and miscarriages, and most recently, heart abnormalities and diabetes. And most frightening to me is that BPA can have these impacts at very low doses. Luckily, just this past January, the FDA provided some guidance on what to make of all this recent flurry of information on BPA. According to the FDA's announcement, they have some concern about potential effects of BPA on the brain, behavior, and prostate. Unfortunately, according to the FDA's own statements, which are listed on page 6 of what I gave you, they are limited in the actions they can take because of how they regulate bisphenol A.
I'd like to get your take on a question that was raised by the Chemistry Association, the manufacturers, which is basically if this is so bad, then why doesn't the FDA ban it?
BPA is regulated as an indirect food additive, and under the FDA current regulations, what that means is it gets a general pass. Companies don't have to tell them how they use it, where they use it, or how much of it they use it. So they're very limited. And they even say in their statement here on their release that it would take them quite some time to work through all this.